Good morning, dear students. Today we will discuss the lecture of front of the thigh with you, Dr. Ahmed Samir, Assistant Professor of Anatomy and Embryology. By the end of this lecture, you will be applied to describe fascia of the thigh, of the front of the thigh, describe muscles of the front of the thigh regarding their nerve supply and action, describe boundaries and contents of the femoral triangle, formation compartments of the femoral sheath, boundaries and contents of the femoral canal, and finally describe the coarse relations and the branches of femoral nerve. Firstly, the superficial fascia of the front of the thigh is formed of two layers. Superficial fatty layer, which is called Camper's fascia, and the deep membranous layer, which is called Scarpa's fascia. It is a continuation of the anterior abdominal wall. The deep layer blends with the deep fascia of the thigh. The superficial fascia of the thigh contains cutaneous nerves and vessels, and also contains the superficial inguinal lymph nodes. Fascialata or deep fascia of the thigh, it is like a stocking around the thigh, surrounded it all around. Above, it is attached to the anterior to the inguinal ligament and posterior to sacrum and coccyx, medially to the iliac, laterally to the iliac crest, and medially to the pubic arch. Below, it is attached to the bones around the knee joint, the two femoral condyles and the two tibial condyles, also patella and head of fibula. We have here three important features of the deep fascia of the thigh, which is called fascialata. Firstly, which is the iliotibial tract. Iliotibial tract is the second band of deep fascia on the lateral side of the thigh. Above, it is attached to the tubercle of iliac crest, and below to the lateral tibial condyle. Its function, it has two important functions. Firstly, it gives insertion to two important muscles, which are tensor fascialata and the gluteus maximus. And secondly, also its function or its main function is to maintain extension of the knee joint during prolonged standing. The second important feature is the saphenous opening. The saphenous opening is an oval opening like you see here. It's about 3 cm below the inguinal ligament. Okay? As you see, the saphenous opening is an opening in the deep fascia or in the fascia lata. Its importance is to pass structure from outside to inside or the opposite. Firstly, we have here a superficial vein which is called the great saphenous vein. It passes from superficial to deep. Also, we have superficial inguinal arteries which are coming from deep to superficial. We have also lymphatics passing or connecting the superficial inguinal lymph nodes to the deep inguinal lymph nodes. And this opening is covered by fascia which are perforated, has many perforations, and as it is called cribriform fascia. Finally, we have the three intermuscular septa. So the features we have firstly is the iliotibial tract, secondly is the saphenous opening, and third we have three intermuscular septa. This is the three intermuscular septa as you see. Okay, this is the first one which is the lateral, and this is the other one which is the medial intermuscular septa, and this is the last one, which is the posterior intermuscular septa. The three intermuscular septa dividing the thigh into three main compartments of muscles. Anteriorly here we have the extensor compartment, and their nerve supply is the femoral nerve. Medially here, the green part, we have the medial compartment or the adductors, and the nerve supply is the obturator nerve. And lastly here, we have the muscles of the back of the thigh, which are the flexors, and their nerve supply is the sciatic nerve. Let's start with muscles of the front of the thigh and discussing them regarding their nerve supply and actions. We have 5 muscles. Firstly, we have 2 muscles from above, from the abdomen, which are iliacus and psoas major. Then we have tensor fascialata, sartorius, and the quadriceps muscle. Firstly, we have the first 2 muscles, iliacus and psoas major. Psoas major arise from above here, from the lumbar vertebra, and iliacus also arise from the iliac fossa. Both of them fuse together to form one tendon, which is called iliopsoas tendon, and it's attached to the lesser trochanter of femur. Here, this is the action of iliacus. It flexes the thigh on the trunk. If it acts from above, flexes the thigh on the trunk. Or, if it acts from below, it flexes the trunk to the thigh. Flex the trunk like this on the thigh. The second muscle is tensor fascialata. It originates from here, from the iliac crest, and it is inserted in the iliotibial tract. As we said before, its action is to make it tense, make the iliotibial tract tense, and so stabilize the femur on the tibia. The third muscle we have is sartorius muscle. Sartorius muscle originates from here, from the anterior superior iliac spine, and inserted here in the upper part of the medial surface of the tibia, and this part has 2 other muscle insertions, and the 3 muscles are abbreviated by SGS. Sartorius gracilis semitendinous. Sartorius gracilis semitendinous. The action of this muscle is to put the leg in this position, which is the cross leg position. To make this position, you need to make here flexion and abduction and lateral rotation at hip joint, and flexion here at knee joint. So you have flexion, abduction, and lateral rotation at the hip, flexion of the knee. Both together, it forms the sartorius positions or the cross leg position. The fifth and last muscle we have is the quadriceps muscle. From its name quadriceps, it means that it has 4 heads of origin and 1 tendon for insertion. The 4 heads of origin we have here, one is called the rectus femoris, and this is the only head of them reaching the hip bone, while the other 3 heads are called vastae, vastus lateralis, vastus intermedius, and vastus medialis. This one is vastus medialis and this one is lateralis. Okay, and here below the rectus femoris you will find vastus intermedius. The 3 vastae arise from the femur. So the only part of the muscle which arises from the hip is the rectus femoris by 2 heads, straight head and reflected head. All use this unit together, forming this tendon, which is called the quadriceps tendon, quadriceps tendon inserted in the base of the patella and continued downward as ligamentum patelli, which is attached to tibial tuberosity. Both vasti medialis and lateralis gives a tendinous expansion here, which stabilizes the patella in its position, which is called patellar retinaculum. You have here one which is called medial patellar retinaculum, and you have the other one here which is called lateral patellar retinaculum. As you see here in this table, this is all the muscles we discussed, and this is its action, as we said. Okay, sure, the quadriceps is the main extensor of the knee joint. The main extensor of the knee joint. Rectus femoris, which is the part of the quadriceps that arise from the hip, it also have another function or another action. It flexes the thigh. Okay, you have here the sartorius, as we said, the cross leg position, which is flexion, abduction, and lateral rotation of the thigh, and the flexion at the knee. Okay, we have here tensor fascialata, which tenses the iliotibial tract to stabilize the femur on the tibia. And we have psoas major. If it is work from above, it flexes the thigh, and if it is work from below, it flexes the trunk. The nerve supply of all these muscles is the femoral nerve, except you have two exceptions here. Firstly, tensor fascialata by superior gluteal nerve, and psoas major by lumbar nerve 1, 2, and 3. The first and the second and the third lumbar nerves. In the second part of our lecture, we will discuss together the femoral triangle. The femoral triangle is a triangle in the upper 1/3 of the front of the thigh. Its boundaries, superior, here you have the inguinal ligament. Medial, you have the medial border of this muscle, which is called adductor longus, this one. And as we take it from the medial border, we make the adductor longus as a part of the floor. On the other side, the lateral boundary is the medial border of sartorius. The medial border here, so sartorius is excluded from the floor. The apex is the meeting of the two medial and lateral boundaries. The roof is skin superficial and deep fascia, which is called fascialata, as we said before. And the floor, it's formed of four muscles from medial to lateral. Firstly, adductor longus. The second one is called pectineus. And the third is psoas major. And lastly, iliacus. The contents of the femoral triangle, you have from medial to lateral, firstly, which is a femoral vein, femoral artery, and femoral nerve. It's called femoral vein. From medial to lateral, you have femoral vein, artery, and nerve. And here, along the vein, you have the deep inguinal lymph nodes. Both the artery and the vein, the upper 4 cm of them, below the inguinal ligament, is enclosed within a sheath together with the lymphatics, which is called the femoral sheath. But as you see, the femoral nerve is outside the sheath. You have also here two contents in the femoral triangle, which is the femoral branch of genitofemoral nerve here between the artery and the vein at the sheath, inside the femoral sheath. And you have here another one at the lateral side of the triangle here, which is called lateral cutaneous nerve of the thigh. The femoral sheath, which is this one, This is an elongation from the fascial covering of the abdomen anteriorly made by fascia transversalis and posteriorly made by fascia iliaca. It covers the upper 4 cm of the femoral vessels inside the femoral triangle, as we said before. It is divided by two intermuscular septa, this one and this one, into 1, 2, 3 compartments. The first compartment is the lateral one containing the femoral artery. The second compartment is the intermediate one containing the femoral vein. And the last or the most medial compartment is called the femoral canal. What is the femoral canal? It's about ½ inch long. As you see here, this is the femoral sheath, and this is the two septa, dividing the sheath, as we said, into 3 compartments from lateral to medial. The first compartment is the most lateral one, containing the femoral artery with the femoral branch of genitofemoral, the intermediate compartment containing the femoral vein, and the most medial compartment is the femoral canal. The femoral canal here, it contains a lymph node which is called Colloquet lymph node. Colloquet lymph node. The femoral canal open in the abdomen, and its opening is called femoral ring, which is closed or covered by a septum which is called femoral septum. This is the femoral ring as regarding its boundaries. Anteriorly here, this is the inguinal ligament, okay, this part. Here, behind that is the pectineus muscle. Medially, you have a small part of the inguinal ligament which is called lacunar ligament, and laterally you have the intermediate compartment of the femoral sheath, which is the femoral vein. So the boundaries once again of the femoral triangle: anteriorly you have the ligament which is inguinal, laterally you have another ligament which is the lacunar, behind you have the pectineus muscle, and laterally you have the femoral vein. The applied anatomy of this part is the femoral hernia. Femoral hernia here is more common in females. It occurs due to increase the pressure inside the abdomen, due to straining, due to cough, continuous cough, due to labor, okay? Anything which increases the intra-abdominal pressure. The hernial sac here is passed through the femoral canal, pushing the femoral septum down. As it descends, its direction will be forward through the saphenous opening, and then it passes upward and laterally towards the anterior superior iliac spine. And lastly, the femoral nerve. Femoral nerve, it arises from the posterior division of the ventral rami of L2, 3, and 4 from the lumbar plexus. It enters the thigh here behind the midpoint of the inguinal ligament. It passes lateral to the femoral artery outside the femoral sheath. 2 cm below the inguinal ligament, it ends by dividing into anterior and posterior divisions. Branches. You have branches from the trunk, branches from the anterior division, and branches from the posterior division. From the trunk you have 2 branches, nerve to iliacus and nerve to pectineus, 2 muscular branches. From the anterior division you have 1 muscular branch to the sartorius and the 2 cutaneous branches, which are the intermediate and medial cutaneous nerve of the thigh. From the posterior division you have muscular branches to the 4 heads of the quadriceps, the 3 vasti and the rectus femoris, and you have one cutaneous branch which is the saphenous nerve. Saphenous nerve is the longest nerve in the body. Thank you very much.